What all should be kept in mind by a patient while on homeopathic treatment?
When the patient is on homeopathic treatment, a patient has to first of all understand from his attending doctor or homeopath about what is the scope, what is to be expected in a given case. And he has to also find out if some other treatment is also required at the same time in continuation with homeopathic treatment. For example, if you are getting treated for say psoriasis or for lichen planus or for asthma, and if you also have diabetes or hypertension, you would require to continue other medicines. So you have to make it very sure with your physician what other medicines are required to be continued in association with homeopathy. Well, just like with any other treatment, when you are on homeopathic treatment, you are suggested to have good lifestyle, healthy state of mind, try to be away from stress as much as possible. These are some of the things to be taken care of. However, there are no very specific guidelines which are related to homeopathic medicines if once you are on homeopathic treatment.
Would you want to clarify certain myths related to homeopathy?
Well, homeopathy, there are several myths around homeopathy. For example, some people believe that homeopathy is very slow to act, and some people believe that homeopathy is very fast to act. Both of them are myths in my opinion. Homeopathy is relatively slow to act, but it is not very slow. Depending on the nature of the disease, sometimes it takes time to produce results. So people tend to believe that homeopathy is very slow. At the same time, in critical conditions or in severe kind of disorders, say painful conditions or infections, homeopathy is relatively slow. It is not as fast. It cannot be as fast as the antibiotics or corticosteroids or certain painkillers. So we have to accept that. So other myths about homeopathy include the use of coffee or garlic or onion. Well, in my personal experience, we believe that coffee can be taken with homeopathy. There is no need to give up coffee or onion if you are on homeopathic treatment. One more common misconception about homeopathy is that when you take homeopathic medicine, your disease initially increases. Well, this is not true. It is not expected that after right kind of homeopathic treatment, your disease has to increase. It doesn't actually happen. This is a misconception which I would like the viewers to know, that don't get scared of such so-called aggravation after starting homeopathic treatment. And there are several small other misconceptions which you can read on my website. I have written in detail about it. Well, many such myths I have written about on my website, which is askdrshah.com. On this I have written a range of articles and various topics, and which are of interest to people, to lay people, where I have written in detail. I have also given a lot of videos talking about the scope of homeopathy for various diseases, which can be checked at askdrshah.com.
Based on your research as an expert, how do you rate homeopathy when compared to other forms of treatments?
Every system of medicine has advantages and limitations. The conventional treatment has its own strength as well as certain limitations. So is homeopathy. Homeopathy, as I said earlier, is very good for the treatment of chronic and recurring diseases. That is the strength of homeopathy. Homeopathy is not very good for critical conditions or severe conditions. That is a limitation with homeopathy. That's how we can compare this with homeopathy and the conventional treatment or the allopathy. In my opinion, what is important is to make a strategic alliance or a collaboration or a combination of the conventional treatment as well as homeopathy, depending on the case, to get the best of both the systems of medicine for the advantage to the patient.